Now we're going to look into hand, wrist and fingers. You can have a carpal tunnel syndrome, which is a very common problem here, and we could be able to treat that. Why is Skanlab beneficial on using carpal tunnel syndrome? It optimizes the circulation, it optimizes the elasticity in the tissue in the area. It could decrease the amount of tingling sensations in the finger, the hyperesthetic feelings they can get, and the sleeping fingers. In the long term, it might go for surgery, but it can be helpful for a longer period if you use that regular, like 2-3 times a week. We also could look at fingers with a rheumatic arthritis patient. They have several fingers that can be affected or rheumatic arthritis, but if you're going to treat the finger joints, you will prefer using the smaller treatment head because that is more applicable for those small areas. But now I'm going to demonstrate the carpal tunnel syndrome treatment. We always put some cream on the return electrode first, and in this situation it's not so pretty for the patient to have it underneath the arm because it gives some pressure on the bony structures, so you don't get the optimal connection. So I prefer the patient to hold it in his other hand. Just hand hold it there, and good firm contact, not like he's whitening his knuckles, but just good contact. Then we put some cream on the treatment area, and hopefully the patient is able to rotate the arm as much as this. If there should be any trouble, you can always put a pillow underneath here to kind of stabilize it and give the patient a more comfortable situation to hold his arm. But he's okay with having it like this, so we can work him like that. We go back and pinch the wrist, and then we get the carpal tunnel syndrome. Okay, we get the dosage and the treatment time. We have enough lubrication here to be able to treat now, so we just pinch the on button on the treatment head. You can do it on the machine as well, but it's much easier to do it on the head. And you can go higher or lower with the intensity during the treatment if the patient's feeling is becoming too warm. We don't have too much soft tissue here in this area, so we are closer to bony structures, meaning that it might get quicker hot than working on a muscle. We start the treatment. Firm contact, no big pressure on it, nice circles, work the area plus a little bit further proximal of the issue area. Asking the patient, is it becoming too warm?
It's okay.
It's okay. You ask him regularly, especially when you start on a pretty high level, when you start the treatment. Then you ask him regularly in the start. After half of the treatment time, you probably have been going down 1, 2, 3 steps, and meaning that you can probably stay on that level for the rest of the treatment. Is it too warm now, sir?
No, it's okay.
If it turns to warm, I pinch -1, 2 times, 1 every time, and check it again after a half minute, 20 seconds. And then all of a sudden it says, it's not so warm, I don't feel too much of it anymore. That means that you might have to go up 1 step again. So you have to play back and forth with up and down. This is a problem that you don't really fix with this, but you can make the life more comfortable for the patient, and especially also after this, if they had some surgery for this. It can be some scar tissue you can treat with this one as well, to smoothen the scar up much more. After stopping this treatment, the treatment time is gone, we hear a bling sound on the machine, and then we just have to clean the area. Wipe off the cream of the patient and also of the solid return electrode and the treatment head. After doing that, we use some disinfection to disinfect the treatment head and the return electrode. And we also use some disinfection or pure water just to get rid of the rest of the cream on the patient as well. So if you, after this, you might be able to kind of work the knuckles, the joints in the wrist, to mobilize it a little bit if they have some extra stiffness. It's nice to get rid of all the cream, then to get a proper grip on the patient, that you don't slip because it's too much cream in the area. So that's also a reason why we wipe it off with water or spiritus, to get it really dry and nice to be able to work the area with manually afterwards.